Hi, this is Dr. Randy Hurst. I'm entitling this video, again, basic educational kind of information. Hopefully you'll be able to use it, but understand that anything that you do try to use is up to you and your responsibility. I don't have any connection, know anything about your personal situation, so whatever you use, please know it's on you. And especially if you ever get into a situation, this video won't have anything that I think is problematic with this, but if you ever get overwhelmed, find that you're not following through with anything you do try, or it just causes too much stress, get professional help. Okay, this one is, I'm just calling it Unintended Consequences. And the idea here is that I don't think anybody ever plans on becoming an alcoholic or an addict or controlled by drugs or by eating or by gambling. It might intend to spend a lot with credit cards, but I don't think anybody intends to go out and get out of control with it or to be ruled by anxiety or fear. So how does that happen? If we know that anxiety is an anxiety disorder of some kind or another is the most common of all diagnoses that people might end up with in their lifetime, in the sense that something like 24% of people in their lifetime may end up having a period of time where an anxiety disorder is overwhelming, it takes over too much, and they need help. Alcoholism there's different lifetime estimates from 18% to 10%. Drugs, depending on the drug, can be a pretty substantial number of people that can get into trouble. So how does this happen? And one of the things that I think is important is the question of, is this just, some kind of moral weakness? There's just something wrong with the person, or which is kind of the way people often will react to it. But we'll talk about that look at the actor-observer bias at some point video. Is it biology? And to this one, let me say, yes, it is. Some people seem to be more vulnerable genetically. Just with their body has a different reaction to anxiety, or is vulnerable to addiction of some kind. People can have a family history of addiction. That doesn't mean everybody in the family will have it, but there's a higher percentage of people that will end up addicted if they have a family history, which you kind of use, if I remember right, something like if there's more than 6 people in 2 generations with an addiction problem, then you are much more at risk than the average person. So it's a bigger challenge to deal with it if you recognize that anxiety, shyness, for some reason shyness is the most inherited of the anxiety issues. And it doesn't necessarily mean anything more than being shy or interfere, but sometimes it can, especially if the shyness starts to kick in and you start avoiding more and more situations because you don't like feeling shy. But it's also biological in the sense that if you had a real fearful or real traumatic situation, you can end up having the body react to similar situations or memories of that situation in a way that, going to the Fire Together, Wire Together video that I've done, the brain cells get to wiring together in the pattern that you develop. So if that pattern is avoidance of anxiety, reacting real strongly to something that might be threat, uncertainty, or things that are similar, then it can become part of your pattern because the brain cells are starting to wire in. Very interesting thing that I just saw is that weirdly, that having people in the hospital after a traumatic situation, having them play Tetris Now, this probably especially works in the few hours after a traumatic situation, but having them play this little game, video game, that keeps them very absorbed and off of what just happened actually seems to reduce the likelihood that they'll later get into a real pattern of reacting to the threat or the trauma later on, compared to somebody who's sitting there and they're going over what happened, or people are asking them what happened. It can start to kind of burn a circuit, so to speak. Rewarding your anxiety by avoidance, or rewarding your desire to drink or to buy or to gamble, or that rewarding that thing that feels good, is something that again fits that fire together, wire together circuit making thing in the brain, that the more you do it, the more automatic it becomes, the more it just becomes part of you. The one way that this isn't biological, it's arguable, is that as thinking human people can stop and intentionally choose behaviors, we can override. I worked in the alcohol and drug field for a long time. And one of the things that happened, especially back in the day, so to speak, is that people would say, you have to quit. You have to completely abstain. And people who did it found they could do it. But it took months, sometimes years, to where what felt right was to go back to the old pattern, react the old ways. And by just having one rule, don't drink, don't use, they would go through sometimes emotional hell, because the circuits that they'd built up, the fire together, wire together circuits they'd built up through the years, wanted what it wanted. And people who would trust their gut would go back to using. People who said, no, I can't do that, overrode the feeling. Not the feeling. The feeling is there. They overrode the action. And they overrode it enough times, over enough time, that new circuits could develop. And the old circuits started to lose ground. The longer somebody used, the more situations that somebody would use. Same with anxiety. The more situations, or the longer that anxiety caused them to get away from whatever made them anxious, avoid those situations, the longer it tends to take to write a new set of circuits, a new set of options to go through. But that's the way to change. That's the way to change how one feels, is by doing the new thing. And look at the racquetball metaphor, maybe even the shower video. What they're about is that knowing what to do doesn't mean it feels right. Knowing what to do doesn't mean you'll automatically do it or know how to do it. It's the doing that both gets the new circuit we're beginning to develop and grow stronger, but it's also the new circuit that gets us to feel like, this doesn't feel right. This isn't who I am. This isn't what I want. It just doesn't feel right. Because it's that old pattern that became who it felt like we were. And how do you change that? Well, my way, and the way that I worked with people, and it really made sense, is that you are not your brain. Your brain learns how to do things by this wiring thing that, before we were in a situation of intentional learning, it just did its thing. You did things over and over again. It learned it and became more and more automatic. that was great for them. But now in a different kind of context where we're trying to make intentional choices to change, going by how you feel will slide you back into all the old stuff. So it's important to think longer term. Think of what you want to be about, what your values are, how you want others to see you, and building on strengths that you're growing, that you're becoming, and getting through fears or getting through temptations to whatever it is, spend, eat, use, drink, whatever. Patience is huge. The racquetball metaphor is one, using a very simple little idea where I learned to play racquetball and learned how much patience is the key, as well as a lot of practice. And this is really what I'm saying in this. Pressing yourself to do the new thing, but also not pressuring yourself in a way that just overwhelms, because that overwhelmingness can lead you back into old patterns. You're needing to build this new wiring and trusting that you can press through. Look at other things that you have learned to do and that were hard in the beginning, and just the repetition and the doing, growing these new ways that you want to become more of. That's going to help. Take stock of gains that you've made or things that you want to do better, but don't hammer on yourself. All that does is add stress and set up for the possibility of sliding back into old patterns, because when we're stressed, it's easy to slide into old ways of doing things, ways that feel right or used to feel right. So it won't go fast. It won't go as fast as you want, but it's worth doing. It's worth trying. And really, one huge key is that if you do go to therapy, which I think can be great, I did it for many years with people, it's never the therapist that does things. The therapist facilitates, brings new ideas, assesses, brings up things that you may not have noticed before, poses possibilities, helps build skills, goes through things with you, practice, plan with you. But it's always the real work is what happens between sessions. The patients who come back a week later and they haven't really done anything because they're waiting for the therapist to do something that fixes, they don't do well. When the patient really gets that what you've talked about is what you do day by day by day by day between sessions, those are the ones that are rewiring. Those are the ones that are getting the changes happening inside. Hope that makes sense. Think it through. See, is there some small thing that you want to work on rewiring? Look at the shower example as just a goofy thing, or the racquetball metaphor. Okay, thank you, and hope this helps, and hope you see more.